Do you want your wine glass in the shot?
No, yeah, we're okay.
Well, now you're live.
Now we're live.
So it doesn't matter.
Hi, everybody. Welcome to COVID CONVOS Holidays Edition, I think is what we've been calling it. It is like, it feels like we're at the start again.
I should have called Jarita back.
You should have. And we kind of are at the start again. But it's really nice to kind of be able to get together and like talk about the apocalypse. So I think we'll probably just do the thing we usually do, which is introduce ourselves and then kind of get into some questions. Before we do the introductions, though, if anyone has any public health, Omicron, COVID style questions that they are burning to ask, then please just put it in the comments so that we can respond. And I think we'll just go from there. So do you want to start, Marsha?
Sure. Yeah. So hi, everyone. I'm Marsha Anderson. I was just admiring my own earrings.
They're very good.
Yeah.
Yeah.
They're nice and soft and quite comforting. Just something that we all need these days. So I'm a public health doctor. I am a single parent to 2 kids who are 8 and 11. So just one dose of vaccine that impacts our decision making. I think that's about it. Yeah.
Yeah.
Definitely feeling like we're back at square one in terms of what's looming ahead of us and how we try to mitigate or buffer the impacts of what we might see come January.
Alrighty. Thanks, Marsha. It's like it's a real positive COVID convo moment in time here. But I think c'est la vie. December's a hard month, man.
Oh, December sucks.
Like it's already hard. And we're queer, it's already hard. So, we weather Decembers all the time, so we will weather this as well, theoretically, potentially, after we get all this important information from COVID Convos. So there you go. Levi, do you want to introduce yourself?
Hi, I'm Levi. I work at Sunshine House, and yeah, December sucks. But I'm real happy to be here with you. 2, 3, the Cokes, Christmas tree, Jude and Theo back there. The cat's around here somewhere. I
think we should count the other humans in the room before the coach.
That's fine.
It's a good coat.
Oh my gosh, we have a full hour of this time, folks.
It's been a long time. I don't know what else to say. This is weird. It's also weird we don't have I'm watching us on the phone, so I'll monitor for questions.
Oh, perfect. That's
There you
good.
go.
We haven't done this all together in a million years, and this is probably the last time we'll do it all together for a little bit. But we thought we would come together and just go the way we had gone right at the very beginning of COVID Convos, and hopefully talk through some of this stuff and figure out what's important to you guys and what's important to us. And so I think we'll just go from there. I'm Margaret, by the way. I'm a nurse and a giant homo, although it's hard to remember that when you're in COVID. Like, I am not around enough queer people in my day-to-day life. It's a big gap. And so I have a little girl who's 10, and she's also got her first vaccination. And I am just like, I just haven't done anything because I just have people in my life who are immunocompromised or who can't access vaccine or haven't been able to. So I just really miss everybody. So I'm happy to see you guys in person also. I work mostly in doing work around sex and drugs, personally and professionally. And I feel like we have to do in the world, and we'll see what we can figure out today together. Do we have any questions? Before I jump into my questions, do we have anything coming in on the Facebook?
No questions on the Facebook.
Okay, perfect. So
I'm getting my booster shot tomorrow.
Oh, yay! I get mine right after, I think December 28th. I'm on my 3rd note. We'll get my booster.
I think
and I had mine a while ago.
Yeah,
I think here there's like a batch of us that are eligible now, and then there's a batch in early January. But then we'll all be boosted.
And maybe we should have a quick conversation about why are we calling it a booster and not just the 3rd part of the series? Is there anything we can talk about that?
Sure. So
I don't know. Booster feels like it's optional to me. Like I feel like people
Yeah,
say booster and
booster.
it feels
Yeah.
optional
Yeah, yeah,
instead
yeah.
of being like, get it.
I just think the thing is we have boosters for a lot of vaccines and it's not optional. So tetanus is an example that I often use where, you have a primary series when you're little. The primary series is the first batch of doses that you get to the maximum effectiveness, right? And so most of us get those in childhood, the primary series of shots for tetanus. And then you're supposed to get it like every 10 years or so. And if you lapse and let's say you get bit by a dog or like have a rusty nail in your foot or anything like that, one of the things the emergency room or your healthcare provider is going to do is give you a booster shot of tetanus. And really nobody questions that because having like the tetanus disease actually really sucks. And so it is completely usual that for vaccines to maintain their high level of effectiveness across a variety of bacterial and viral infections, that we need to have boosters. The thing with the COVID-19 vaccines is there might be a time when we call this 6-month dose part of the primary series. Right now we call it a booster. The thing is we should consider it completely necessary. What we knew, even with the Delta variant, was that we start to see waning immunity. The body's immune response, like the antibody levels, etc., starts to drop off. We start to be less protected, mainly against mild infection. So that's part of the reason we see more breakthrough cases is that waning immune response. A booster dose increases that immune response again, primes our antibodies again, so that if we're exposed, we get a much more vigorous, robust defense. Now, what we're learning about Omicron is those boosters are really, really important for preventing both mild disease and severe outcomes. So in no way should we think of these boosters as optional. One of the most important things we should be doing is everybody who is eligible. So if you had your second dose on or before July 10th in Manitoba, trying to get your booster dose as soon as possible, booking it, finding a walk-in location. So the urban indigenous clinics, for example, have walk-in appointments available, keeping an eye out if the province opens more vaccine appointments at the super sites, checking with doctors and pharmacies. One of the most important things we can do before the holidays is get that booster dose if you're eligible.
Yeah, so if we want to get laid for 2022, we should get a booster. That seems basic, guys. We can do that. Queers have put less in their arms for more. More in their arms for less. So let's do it. How about? More in their arms for less is the correct one. But you all know what I'm talking about. So I think we can all just move along with the boosters. Yeah. Exactly. And then Marsha, what about for kids? Like, so the kids who got their first doses at the beginning. When do we, like, what about their series? Is that different?
At this point, not really. Okay. So the recommendation is 8 weeks between first and second dose, except for some situations that are higher risk. So some kids who might be more moderately or severely immunocompromised or in First Nation communities. And really what we're trying to do here is balance the benefits of achieving full protection sooner with the risks of waning immunity, which will happen faster the closer those two doses are together, okay? So a longer interval is better for longer lasting immunity, for sure. And then the other thing is the risk of that heart inflammation, the myocarditis or pericarditis. So this is a low risk, like at most 1 in 10,000 people who get the vaccine. And that highest risk is in people with testosterone, so males, between kind of 15 and 24. So those really high testosterone levels do make the risk the highest. So again, between 5 and 11, less likely to have those high testosterone levels. So the risk of myocarditis or pericarditis probably lower. Nonetheless, sticking with that 8-week interval is probably the benefits of that are going to outweigh the risks for most kids.
Okay. And so just to be clear, the risk around myocarditis, even if you get it, we treat it, right? Like we kind of take care of folks.
Yeah.
And mostly they're okay. It just is
mostly they're okay.
Yeah.
You know, chest pain, shortness of breath, tightness. can be treated. And then I think the other thing we have to keep in mind, and this maybe doesn't get talked about as much, is that there's also a risk of myocarditis or pericarditis with COVID infection. And the risk is higher if you get COVID than the risk is if you get the COVID vaccine.
All right. Got that, everybody? So that's, yes, very good. Helpful. We have a few questions.
And a comment.
And a comment. Okay, well, let's just, oh yeah, somebody fucking loves my comment about, anyways, we all know.
We all know.
It was a good one. But some folks are saying, one question is around, do we think Omicron is less severe? So maybe, actually, let's get into Omicron in a second. Let's scooch down to the second question, which is still around intervals and vaccines.
Okay.
So is it true that the province moved the interval for third doses to 5 months from 6? You heard about that?
It's not completely true. Okay. So there was a one-time announcement that if you had your dose on or before July 10th, that announcement was made on December 10th. So on that day, it was 5 months. But aside from that, let's say you got your second dose on July 28th, your interval is still 6 months. This might change. People are probably paying attention to the news elsewhere. So Ontario, for example, announced it's going to a 3-month interval for the booster doses. But as of right now, the people who are eligible for boosters are people who had their second dose on or before July 10th.
Awesome. Okay. So I think we probably better get into chatting.
Theo
about
actually had a question.
Oh, Theo does? Great.
Yeah, ask it in real life.
Yeah, we can all hear you.
Someone who takes testosterone, are they at a higher risk for?
That is a really good question. And that's something that I will look into and get back to you because I'm not sure what their testosterone levels would be in the body compared to like the sex assigned at birth levels. Yeah. Thank you for that question.
Alrighty, do we have more? Oh my gosh.
Then there's
Listen.
the Omicron.
Oh yeah, right. Okay, so let's move into chatting a little bit about the Omicron variant.
How do I pronounce it first?
I don't know. Omicron.
Is it a Greek
It's
letter?
it is a Greek letter apparently. It's either Omicron or Omicron, depending on who you ask.
How do we feel about that? Place your, I guess you can't really in the comments explain which option you like better.
I'm gonna try to stick with Omicron. It doesn't mean it's right. It's just I'm trying to be in practice because I've fucked up the pronunciation so many times.
All right, we're gonna Omicron it. Yes, we can.
We're gonna Omicron.
We are. We're Omicroning it here today. I think we better actually just have a quick conversation, maybe just a little here's part of why we were like we best be on the COVID convos to talk a little bit about sort of what's coming down the pipe.
Yeah.
And then maybe we can talk about some of the things that have like some of the evidence that's happening now, because I do think we've had some mixed messages because people don't know. It's brand new. And so we're basing our decisions on the best available evidence, but the evidence has shifted a little bit.
Yeah, the knowledge base is growing continuously, and some of what we're learning today is different than the initial impressions. So a few things about the Omicron variant. It was detected in South Africa. We don't actually know for sure that that's where it originated. South Africa actually has a very robust FE surveillance infectious disease program. So we attribute its detection there more to their expertise, right? So just to say that first of all, it is now widespread in the globe. Well over 70 countries have detected Omicron. See, I almost made up a different word again.
Good.
I've been saying Omicron. That is completely incorrect.
I mean, it just sounds like a transformer.
Omicron, yes.
I'm like, it's like Optimus Prime, Omicron Prime. There. Yeah.
Yeah. Sorry for that tangent. Yeah. So yeah, detected in over 70 countries. What we know for sure is that it's a little tiny bit of science. It has more than 50 mutations, which is the most mutations any previous variant has had. It is highly transmissible. Once community transmission starts, case rates grow exponentially. This isn't modeling, this is real life data. So it's doubling time, which means how long does it take for you to go from 50 cases to 100 cases and then to 200 cases? Its doubling time is at most 3 days compared to Delta, which is 34 days. And Delta was not good.
We were frantic about Delta, if we can all remember. Delta was like a big deal. And this, so 34 days to 3 days.
So I don't know.
Oh, the papers.
Oh,
Maybe
it's
it's
pulling
the
up.
time to
It's
pull out
time.
the
It's time to pull up the
papers.
paperwork.
Might have to get someone to hold it up closer.
Or Levi can
Here,
draw
Levi.
it on our board. Who knows?
No, I don't want to read the
Could you
drugs
hold
board.
that? We're gonna look at the blue line with the sharp increase up.
It's coming for you, everybody.
Here.
That's Ontario's real life data. This is publicly available from the Ontario Science Table, but we can see that sharp incline. That's what a doubling time of 3 days produces.
Yeah. So that giant straight vertical line, that's what's happening there right now.
Yeah. So the thing with Omicron is there was lots of questions around, is it as severe as Delta? Is it more severe? Is it less severe? Because really the difference between when we manage this as a pandemic with public health restrictions, et cetera, is are we gonna collapse our healthcare system or not? Are we gonna have excess morbidity and mortality, so people dying or having hospitalizations from it or not? We don't really care too much about viruses that cause mild symptoms or diseases like rhinovirus or other causes of the common cold. We're pretty happy just to let them circulate in the population. When there's a potential to produce severe outcomes, hospitalizations, ICU admissions, deaths, that's when we get concerned about our like the fact that people will get very sick, some of them will die, and we will impact our healthcare system. And anyone in Manitoba knows our healthcare system is under strain. We're struggling to manage with our current caseloads.
Yeah.
And we have really unprecedented numbers of people waiting for surgeries and diagnostic tests. And that also does cause harm in the population. Lots of concerns about later stage diagnoses of cancer and things like that. So the thing is with Omicron, initially they thought maybe it was somewhat milder than Delta. Even in the best case scenario where it's somewhat milder, it's going to cause so many cases that we are still going to see significant healthcare system impacts. Significant numbers of people are still going to need to go to the hospital, maybe admitted to the ICU, maybe pass away from it. Some of the emerging evidence from Denmark and other jurisdictions is that actually it's as severe as Delta. So hospitalization rate in Denmark, if you look at the Ontario Science Advisory presentation, shows that the hospitalization rate is actually the same as Delta so far. Okay. Now, this is why Ontario has started taking measures like shortening that booster interval to 3 months to get more people boosted. The data is showing we need those boosters to have that high level of effectiveness and protection against Omicron, and where they're going to be taking measures to reduce close contacts to try to blunt the impacts of this Omicron wave. And where we're at right now is we don't know about community transmission in Manitoba. And so we have an opportunity right now to kind of delay this wave till antiviral treatments are approved, possibly in January, as early as January. More people are boosted. So in my mind, that's our goal right now, is really to try to delay that sharp upswing of exponential growth for those things to happen.
I mean, that seems very reasonable. So just to be clear, like for that question around whether Omicron is less severe or more severe, right now like what Marsha's saying is it's looking like kind of the same, just like extra happy to jump on to wherever it can, like just easier to catch. And then the other piece is around, so what do we do now? So there's even a question in here talking about restrictions. What do we do personally? And especially in a province where our government has traditionally been a lot slow to respond to some of this stuff. Like, what are the things that we should be thinking about in our own communities? I'm interested to know sort of like what we think, and then whether we think there are restrictions coming. Like, what do we think's on the horizon?
Oh, speculation.
I love that. Marsha hates speculation, but I'm willing to go down that path. So,
I mean, the first thing I would say about restrictions is many jurisdictions are starting to put in enhanced restrictions. And all of those restrictions are really focused on reducing close contacts with more people. So whether we have restrictions imminently or not, which is not something I'll speculate about, there are still things we can all start doing immediately to reduce our own close contacts. We don't want to wait until we know about widespread community transmission of Omicron, given what we know. So how do we start reducing close contacts? So this is going to be part of my circle, few people that I will socialize with, you know. It'll be kind of tightening down like that again. I won't be going into a full lockdown, but I'll be decreasing the number of people I'll sit down and have a drink or a meal with, for example. We'll try to socialize outside again, right? Personally, most of the time I wear a medical grade mask. I think it's worth considering, if you have access to medical grade masks, wearing them in indoor public places. But the main thing is, what can you do to decrease your close contacts, including in your home, who you might be having over for holiday events or celebrations?
Holy heck. All right. So I'm trying to think about what that actually is going to look like a little bit, you know, where so for me personally, I'm trying to figure out, like, if I have people who are supposed to come to my house on Saturday and I'm a little unsure about what we're going to do and how we're going to do it and whether we're going to do it. And it's not a thing that I generally do. Like, I barely see anyone as it is, which is why I'm happy to do anything queer. But just thinking about what that kind of means for community and all that sort of stuff, I don't know, like, how's that land for you guys? How does it land for you, Levi? Marsha?
Well, you know, I was just going to say, I think even in the home, like, let's think about dropping down those numbers, thinking about physical distancing with people who are not your usual close contacts. So between household groups again, you can think about asking people to wear masks whenever you're not eating or drinking. One of the things that's talked about is you can leave your windows open. I mean, it's going to be pretty cold, but anything that increases ventilation might also be a way to make the gathering a bit more safe. And hey, if you have space where you can be gathering around a fire pit outside, like,
Yeah, that's a good idea.
even better.
Also, opening the window, like, some of us are perimenopausal, y'all. So I'm not really pressed about an open window in the middle of the winter.
Well, and so many people live in like radiated.
Seriously,
and they're
where the rads are going, the
all
window's
the
not
time.
open, your windows are constantly open.
Yeah.
Here, this is nothing new at all.
Yeah, our windows have been open for 10 years straight, actually.
Fans are always going in winter.
It's so real. Yeah, I love an overhead fan all winter long. I'm here for that. Anyways, all right, so fair enough. So I think thinking about Omicron, thinking about restrictions, like, how are you guys doing? Like, how's it going otherwise, like, in the world? Like, how does it feel? I feel like I am, like, in apocalypse mode right now. Is that sort of where we're at? Sorry, I know you guys don't like it when I ask feelings questions, but I'm doing it anyway. Because the people are also
Is there a
having
commercial
feelings.
break soon?
There's no commercial break. Oh my gosh. Listen, I'll bring out a feelings wheel if you're not careful. It's coming for you.
What the hell is a feelings wheel?
It's just a wheel with lots of different feelings, so you can name
She's
them.
Googling, so let's.
I'm not. Okay, so, like, how's it doing? How are you doing? What are you doing? It's that usual question of, like, okay, so this, like, apocalyptic moment in time is happening at the darkest time of year in the middle of a holiday season that is, like, notoriously difficult for a lot of us. And how are, like, I feel like it's like a bit of a so what moment. Like, so what next? Like, so what are we gonna do? What are we? Does anyone?
Well, I would just say I'm feeling a bit of relief, actually, in some ways, because the pressure of social gatherings right now feels like a lot. Mm-hmm. So taking the pressure off in that way, and again, focusing on a small circle of people that I both really enjoy and feel safe with, to me, that's beneficial.
I don't know. Like, it's just whatever at this point. It's like, it's like, I don't know. I feel like emotionally we're all, like, in a dryer, and you're just kind of bouncing around. You're just like, oh, this is where I land for a few seconds, and then maybe the next spin is going to be a little better, but I don't know.
And none of us are getting out of the dryer anytime soon.
No, the dryer's still going.
Yeah, find your comfortable spot.
Grab onto something.
Oh my gosh. Yeah.
That's what I thought. I don't know. Like, I don't actually have any. I'm for like me personally, like I'm not going to be doing any drag over these, so I don't have to worry about like canceling gigs or worrying about that kind of stuff. And then I don't have like real big, extensive plans over the holidays, except for maybe like go see my family in Brandon, but we'll revisit that what it looks like next week, right? So
I know.
and I think that for so many of us, we're just kind of used to but I'm different because I'm single, right? So like I can just cancel plans willy-nilly, and I'm like, oh, my alternative is just go home and do what I do every night, like, so it's not like I have to worry about like other people's well-beings and all of this other than the people that I like work with. So I don't have to worry about like small children or like people that I might be a caregiver for, like older parents or just like loved ones, or so it's like, so for me it's not as an emotionally grueling or draining kind of exercise to have this like looming over, and I get to focus. The plus side is like then I can dedicate some of that energy to be like, what is it going to look like around here?
I mean, honestly, like, and Marsha, like, what, like, do we have any sort of sense of what, like, some of us are running some drop-ins, some of us have folks who are coming into spaces, and we've been working on this, like, 1 to 2 meter distance, but it's sounding like that's not enough space, and, like, is there any sense of that yet?
So for work that has to be done in person, and I think, organizations like Sunshine House, the harm reduction distribution you do, those are really essential services. And those are the kind of things like we need to protect by tightening up in other places so people can have their like really important needs met.
Yeah.
So again, I think services that have to be in person to continue, physical distancing, the 2 meters whenever possible, medical grade masks, important again. I don't think we need to cut down on all of that. I think where we're heading, and other jurisdictions already started this, is where work can be done remotely. It's time to shift back and support people to work remotely again. It's another way to reduce the close contacts that we have. So, we had a pretty good time over the past several months, summer for sure, where we could do a lot more in person with pretty low risk. We're heading into a time where that risk is going to grow again. So part of what we need to do is really think through what's really important to us. How do we protect that? What are essential services in our work or personal life we need to meet? How can we do that as safely as possible? And what can we let go of again for a shorter period of time? Knowing, boosters are going to help, antivirals are on the horizon. What can we let go of for a shorter period of time to protect those things that are essential?
Yeah, I love the way you think about it, Marsha, because I think it's like so easy to just kind of revert back to that moment where we're like, shut it all down. And instead of thinking about how do we like create a buffer around the things that are so, so important, like I want queer people to stay alive through this next round. And so what can we do to think about that? And I've been thinking about it a lot around folks who use drugs too, especially how social getting high is. It's like a social activity for so many people, and thinking about Omicron and what that means, and how do we kind of do that piece with all of it. Like it just like that to me is that's what's been kind of like keeping me thinking things through a little bit and thinking about what is the buffer around, like what is in the same way that we buffer our kids, What are the folks going to be like here? What is the word on the, like, are people talking about this at Drop-In, Levi?
No.
Yeah.
It's just like, why?
Why bother?
Yeah, like
nothing's going to change.
It's
really.
It's just going to mean that things will be a little bit more difficult.
Yeah.
At different places. And so it's like, but I think, and then it also might mean that it's specifically around Christmas time because of what we saw. What we saw when we last saw an outbreak like this is like other places shut down. So then that meant because those places operated with different operational guidelines and principles and just like a different base of people who are working or volunteering in those places. So then what it meant is just that because people are tremendously resourceful, they'll figure it out, right? They'll figure it out. And so people talk about it, but it's just like, I think around here, we've seen a pretty high uptake in vaccinations because a lot of the stuff that people engage with, whether that be through like Main Street Project or Aboriginal Health and Wellness or the urban Indigenous clinics, like those were really, really successful in getting people vaccinated. The vaccine clinics, when they were available, were really successful. And also because people made those vaccine clinics, particularly in summer and the fall, super fun.
Yeah, totally.
Like they were
Yeah.
super
I mean, your
fun.
guys' vaccine
They're
clinics were
DJs.
DJs at a vaccine clinic.
They were
That's
deep.
That is like actually a good fucking lesson for how healthcare
Yes.
should be. Like I should be able to go dancing and get a vaccine at the same time. That seems completely reasonable. And if they're like anyone you ask, if you're like, what would make gonorrhea testing feel like A-okay? It's like pay me, treats, dancing. That seems correct.
Whatever, yeah.
Yeah.
The last one we did, because it was a much more smaller one, because it was the flu and the vaccine clinic, and it was also cold outside.
Yeah.
So we just did a draw, and so people could either win $50 or a pack of smokes or both. So we gave away both.
Sweet.
Oh, and then we had some gift cards too, right? So that was
I love that.
that was it. And then but then the other thing that we've been doing around here, like we've just because we have decent relations, because now we've kind of leveled out and we've formed relationships with the influx of people that we see in a week. We have good relations. We can just talk to them. And just like, this is what's up. And if people still aren't vaccinated for whatever reasons, we still have like rapid testing for people, and we can do all sorts of other things. And we still have people around to support people throughout it, because it's like whatever. We know that systems are always going to be imperfect, no matter how good various bright spots are within these systems. They're still pretty inaccessible for a lot of folks. But like around here, still the daily grind is just like, how am I going to eat?
Yeah.
Where am I going to sleep? And what can we do? What can we do to socialize?
Well, and like they're like for everyone I talk, like they're like really you have to plan out when you're going to get that second dose, because people are worried about side effects. And it's like, when do you do it where you can actually, and where do you go for a couple of days to be sick? You know, I think like that's another piece for some of the folks that I talk to. I don't know if you're folks. What I love about downstairs too is these guys have like a whiteboard full of like updated COVID facts, which I feel like, I don't know. I didn't know half the shit that was on there when I was there the other week. I was like, oh, good to know. You guys are still updating everything.
Well, you have to, right?
Yeah.
Because you have to make it still has to be real.
Yeah.
Like people still have to know why we're yelling at them for not wearing their mask around their nose.
Like, look at the board.
Well, that's the other thing too. We had this conversation last week. Is like, how do we frame just really reiterating that we're not talking to people about putting their masks on over their nose because it's a punitive thing. We're talking about like community safety. It's like just always frame these conversations as community safety, and people get it.
Yeah.
People
Oh
get
yeah.
it.
Totally.
Yeah. So, but it's just we're all like, as I say, where I'm in the tumble dry, like everybody else is.
Everybody is. Like, we're all in an apocalypse. This is why people ask when, like, the how are you question is the most loaded freaking thing these days. And it still comes out of my mouth all the time. And my answer is always apocalypse fine, which is to say terrible, but like, okay. Like, that's kind of how it feels to me. And so it is we're all just in this weird kind of crappy, sometimes okay, because we get to avoid things we don't want to do moment in time. So intense. Anyway, can I ask two more questions that came up just from this little bit? One is around rapid testing. And like, I feel like I have heard lots of people be like, why isn't Manitoba using rapid testing more? Why is, like, how effective is it, et cetera? Do you have anything that you can you teach us a little bit about rapid testing?
Sure. So first of all, there are two different kinds of rapid testing. There's like the molecular-based rapid tests. We've been using these extensively in First Nation communities, for example, particularly in outbreak settings, for months and months, actually, with really great effects. Early case detection supports early contact notification, which means people are isolated, help us blunt responses. This is going to be important too as more antiviral treatments become available. These are treatments that are meant to prevent hospitalizations, but they need to be given soon, like within 7 days of symptom onset. So those types of rapid tests, great. The type of rapid tests most people are talking about, though, are rapid antigen tests. These are different, okay? At best, they're about 50% accurate or sensitive in picking up asymptomatic cases of COVID. So let's say you were gonna be having an event with 1,000 people there, you know, and you're like, okay, well, we'll just make everyone do rapid tests, and then it'll be safer because everyone will have a negative rapid test. Let's pretend out of those 1,000 people, there are 8 cases of COVID. You're going to pick up 4 and you're going to miss 4. So now at your 1,000 person event, you'd have 4 cases of COVID. If it's a dinner event, 4 cases of COVID at tables where you're not wearing masks. So they're not good for that, right? Where they may be useful is when you test people repeatedly. So this is what we do, for example, for some unvaccinated healthcare workers, or some employers do this kind of testing. If you take those tests, every 2 or 3 days, your chances of picking up a case go up because you're doing many tests on the same person serially. And so that's where they can be helpful. What I would say about rapid antigen tests is by themselves,
I think you lost the video.
Yeah. Oh god.
Okay.
Catch up with it there, kind of start.
Surprise.
Ooh.
Are we still on audio? Or
You're still on audio, yeah.
Oh, okay. All right. So I guess I'll just keep talking then.
You might not be able to see us, but we're gonna keep we're gonna keep going.
So the thing with the rapid antigen tests is if we think about layers of protection, and this is really what we want when we're talking about any COVID variant, whether it's a resurgence of Delta or the spread of Omicron, we want as many layers of protection as possible. So we've talked about masking and maybe upgrading for those of us who can to medical grade masks. For sure, vaccines are the tightest and best layer of protection, so we want to do that. Physical distancing is a layer. Hand hygiene is a layer. Rapid antigen testing may add an additional layer of protection. So that's what I would say about that.
Yeah, awesome. And so what are so the ones that you guys are using up north and the ones that people are just kind of getting, are both available to purchase, or is it really only the rapid antigen?
Essentially only the rapid antigen testing
Is what
it's what
people are getting.
Ontario, Nova Scotia.
They're all handing out for free at the bus stations.
Hand out the rapid antigen tests.
Okay, so I feel like that is helpful information that I don't think we're good. We're back video.
Yeah.
Videos back.
Goodness, you
I
can
guess I'm
see
putting my
us
pants
now.
back on.
It's a finicky little USB port.
Serious. Fair enough. Sorry, y'all. Okay, so I feel like that's helpful, like understanding about having to do those tests repeatedly to be able to potentially catch it rather than like depending on it for, safety at an event. That's very reasonable. And then I wonder about, so when you're talking about medical grade masks, Marsha, what does that actually mean? Like, what should people be thinking about? Like, are we talking N95s or are we just talking those surgical masks?
So here's one of mine here. It's like a surgical or procedure mask, disposable, 3 layers. You can find them in a lot of stores. They're not medical masks in that most of them are not actually safety tested the way that medical masks are. So the words you might want to look for are medical grade masks. A well-fitting medical grade mask is definitely better than cloth masks. Cloth masks really hit and miss depending on how many layers they are, how well-fitting they are, things like that.
Whether you've cut a cigarette hole in them.
Yeah.
Whether they're fishnet. Some of those fishnet masks are just not cutting it, y'all.
Yeah. And so the mask has to fit around your nose and mouth and under the chin. If it's gaping anywhere, it's not doing anything for you. So just to keep that in mind. The KN95s are like N95s that get used in healthcare. Of course, N95s are better, especially because they're fit tested. KN95s may be better too, but not as widely available. Not that we necessarily need to go that far, but medical grade masks, interesting to look at. Yes.
I have a question. Just what is kind of the best option for someone who has a large beard? Because
Shave it.
I've had some conversation, mostly when I was working at Walmart, just being like, hey, put your mask on. And they're like, I can't, I have a beard. It's like, okay, cool. So shave it is the option.
I mean, we're not like, say shave it without saying shave it. That's what's happening here.
I guess some people have beards for religious reasons.
That's right.
Right.
Yeah.
Yeah. So, I mean, I think the same principle applies, and I've seen some different creative get-ups. So I've seen ones that tie more tightly around. So anything that minimizes the amount of gaping around the mouth and nose is really what we're going for here. So anything that makes a tighter fit. I don't know, they're laughing at me.
No, we're laughing at gaping.
Gaping.
It's been a long time.
It's the only gaping hole any of us have seen in a long time. That mask moment.
Oh my god. I'm having flashbacks to that episode.
Don't worry.
Romance glass.
We're not going to talk about, well, and then my kid, guys, like, remember when we talked about romance glass and we thought it was so good? And then my kid was like, who is 10, was like, remember when you guys invented that sexy glass? And I was like, oh, yeah, that's what we should have called it the whole time. That's way better. Anyways, see, we circled back. But yeah, sorry, Marsha. Your mask shouldn't gape, y'all. That's the take-home message. And in fact, I feel like thinking about masks too, and I think about like even just like fat people with like chins, like getting a mask that like fits my like luscious face is not the easiest thing to do. Although I do feel like the sort of like the clinic masks that I use they're not too bad. Like they're okay. But I do think like finding a good fitting mask is like, I can't believe we're talking about masks this much now, Marsha. I don't know how you feel. If you're gonna do it, you might as well do it right. With getting the medical grade masks that fit your face if they fit your face, and then ventilate your spaces, open your windows. Jude,
I have another question. What, like we've talked about it before, but now that kind of clubs and bars are opening up again, and like a lot of us here are drag artists and whatnot. What is the efficacy of the face shields? Are they doing anything?
If you're wearing them over a mask, yes.
Okay.
If you are not wearing a mask under them, no.
Gotcha.
You knew that answer.
I did. I wanted to state it for the audience at home.
Mhm.
I know.
it's tricky, and then thinking about, and I think also like this, it's this whole conversation is about individual people and our own choices, rather than being like, are the schools we're sending our kids to ventilated? Are our classrooms small enough that they can actually physically distance adequately? And I think, always thinking about those pieces as well. Like, I just really want so much more for the world in terms of how we're taking care of each other than, trying to make sure that we're doing the best we can in individual basis, which of course we're all trying to do as well, but all this stuff comes up.
Yeah, I mean, I think there's certainly individual risk and individual responsibility, and then there's collective and structural risk that we need to respond to with structural solutions.
Are there any other questions?
No, not in the chat.
Business?
One just came up.
Okay, let's have it.
Oh, I didn't see it on here though.
Oh. Well, yeah, there might be a slight delay, but Matthew says, is it true though that masks are not for you personally, but for those around you and your exhaust? LOL.
That's also how I feel about masks a lot of the time. It completely depends on the type of mask you're wearing, actually. So the non-medical cloth masks are more for people around us, actually. So the more of us who wear well-fitting, multi-layer cloth masks, the less we are emitting potential virus particles into the air around us, okay? But they're mainly to reduce that. The medical grade mask and the N95 mask, because they filter better, also protect us.
Yeah, I feel like we start with
Like any mask, honestly though, when all of us are wearing masks, any mask is better than no mask. So I think it's important that we are clear on that.
Yeah, wear a mask,
Mhm.
I guess, is where we're at, basically. And I think like that's a good example of the collective care. Like, we're all wearing these cloth masks to protect other people, and they're doing the same for us. And so thinking about how we like take that kind of moment in time towards everything else, I think is like all we can do. Okay, well, let's wrap it up then. Hey, if we're sort of like winding down, what are you like? Are you guys doing anything fun? Like, have you done anything fun the past 6 months?
I'm no longer Miss Club 200.
You're no longer Miss Club 200.
That's so nice.
Is this good? Or, okay.
That's great.
Yes, congratulations to Purple,
Yeah.
who is our new Miss Club 200.
Yeah.
And then is that like you're not? Is that your top thing, or what do you like?
Yeah, that's
You're like, it's great, Margaret. It's
the
really
one
fucking
thing I've
great.
talked in the last 2 months. End scene. No, that was great. Like being able to actually be like having that moment in time where we were able to do that without because again risks were really low, numbers were low. So being able to like do that and then kind of pass it on and then having that closure, because even though we were doing things, I still had that kind of like, oh, I have to do a thing, and now it's just like I can kind of put that to the side as I need to focus on other things around here and in my personal life, and so yeah, that's
awesome.
It's just chaos. Everything is just chaotic. So even though things aren't happening, so many things are still happening. It's like I was looking at the calendar today. I'm like, oh, I guess it is like, what day is it in December? Like it's December 17th?
I don't know.
16th.
Like that doesn't feel correct.
No,
that
is
feel
not correct.
That does not feel proper at all. Christmas is next week, and like what is this? How did this happen? And then we just get to go into a new year. We just get to stumble into a brand new year. Like, I don't know. This sucks.
So hard.
I remember when I was younger, and all the old people in my life would be like, "Cherish this moment because time is just gonna fly so fast when you get older." And I'm like, no. Wow, this happened.
Yeah.
This whole thing happened.
Oh my God, the one thing adults weren't lying about to children is time flies.
Oh, they also never lied about how our bodies are going to collapse.
I know.
The most dangerous thing I do these days is sleep. I wake up in the morning and I'm like, oh wow, why does my knee hurt? I'm like, oh cool.
Oh my God.
I guess I slept wrong, so I'm gonna have a fucked up back for 4 weeks. This is cool. I love this.
I wish they hadn't lied about those things and told the truth about drugs. That's what I wish. We would have all had a lot more fun.
Drugs and sex, like
Seriously. Dang. All right. Well, how about you, Marsha? Like, what are you doing? Anything? Like, what's?
you don't have a pool now.
Yeah, the pool is closed up. Although having the above ground pool and deck was a solid coping strategy for the third wave. Yeah, I actually have been enjoying some evenings out with friends, like dinner, drinks. Made it to a couple of Jets games. So, did some socializing and some fun things when risk was lower. Like I said, okay with resting a bit over the next while. Work is obviously picking up. We're going to put an outdoor rink in the yard again and really try to focus on the outdoor activities. Yeah. Trying to bundle up and embrace winter.
We're doing it.
Mm-hmm.
And just so you know, that is a big deal for Marsha because she does not like to be cold.
I hate it.
It's the worst.
Yeah, it's tricky. Listen, we just figured out that we'd basically Rapunzeled our 10-year-old and put her in a tower and been like, sorry, you can't go out for 2 years. And that maybe that would have an impact on her mental health. I don't know what the hell I was thinking. But just feeling like I need to protect my kids so much. But turns out she was talking to somebody about how when she drew a dog, she had to draw another dog so that first dog wouldn't be lonely. We were like, are you lonely? And she was like, I don't know. And we were like, whoops. Oh my gosh. And so we really had just been spending a lot of time recently just trying to be like, okay, like we need to find a balance between like my like parental public health anxieties and also my child having connection with people. She had to start a new school in the middle of, at the beginning of the pandemic. So making friends has been hard. And even though she's connected to friends on the weekends, it's just like, she's just been missing some of that. So I let her go over to somebody's house, which felt like a really big deal to me. Like we hadn't really been doing that. And so she just started getting to do a little bit of that. And now I'm sort of wondering about what that's going to look like in the new year. But that's like the most joyful thing for me is to watch my kid be able to do stuff that makes her feel good too. Cause like we're all kind of just not great, you know? So I just think, yeah, I'm interesting also, Marsha. I'm also trying to be a little bit like, let's all chill and not think we have to do 10 million things. And like capitalism is a pile of garbage. And it is like, it's not possible to take care of community and be in like totally responsive to capitalism at the same time. So I don't know, that's where we're at. So that's, I guess, what we have to tell you about COVID today, you guys. The news is the news, and hopefully it was engaging enough and that you got a little bit of your questions answered. And as we kind of go forward and see what happens, we'll come back and chat with you a little bit more. It's so nice.
Maybe we should make that promise because I think we signed off with that last time in
Being like, we'll
May.
see you in 2 weeks.
Yeah, listen, at this point, the people know we're unreliable about timing. We give you reliable evidence-based information plus some sexual content.
You
But
can
we
also
can't-
watch Marsha like on
That's
the,
true.
on the provinces.
It's true.
It's not as engaging.
Yeah, it's definitely not. They're not talking about gaping holes in the way they should be.
I do wear nice earrings there too, though.
It's
You
true.
always look really,
Marsha
really-
always looks bomb. Like, also, if we're talking about a COVID fashion moment, like a public health fashion moment, every time you show up on those panels and on those pressers, I'm just like, woo!
and then the chief, whenever you're with Brian, I'm just like, oh, Marsha, you should have done that to him. He looks so tired. He looks so tired. And Marsha's like, yes.
Yeah. It's like, let me just like show you my very long, beautiful earrings. Another pair today.
I do that actually.
Yeah.
My hair is away.
Yeah, you've got to.
You do,
Yeah.
yeah.
We just watched Marsha for the earring content and then for just like the cold hard facts, ma'am. Like I feel like that's what we get from those pressers. So and I am here for that. That is also good. Anyways, do you have anything else you guys want to add before we kind of rock and roll?
Yeah.
Go for it.
Just this, which is like vaccines work. Get your vaccines, especially your boosters when you're eligible.
Oh my God, get your boosters, you guys. I want to go
Don't get
dancing.
misled by those pie charts. The vaccines work.
Oh yeah. Oh yeah.
What are the pie charts?
Oh my God, the way that the province talks about like how many people are in hospital makes it seem like, anyways, do we need to have a quick moment about that?
Just, I would say, if we look at actual rates of COVID infection, the vaccines are still working to protect from COVID infection. You're less likely to get COVID if you're fully vaccinated, and you're way, way, way less likely to get hospitalized, and even more less likely to go to the ICU. Vaccines work.
Yeah. So despite those like pie charts that are like, here's how many people are in the ICU and 60% are under, it's proportions, right? So there's 50, right?
Yeah.
Oh,
So-
okay, yeah,
many-
yeah.
There's like
People who
1
are
million
fully
of us who are vaccinated, and then there's 20 in the versus the like 15% of the population, and they're 50. So those pie charts that we see in the newspapers or on the CBC make it seem like, how are all these like vaccinated people taking up all these spots in the ICU beds? And it's like, well, there's a lot of us. That's why. There's a lot of us. So the very tiny, tiny, minuscule amount still accounts for those beds. Anyways, listen, I had to have that like conversation with Marsha, and it was that, and I was like, oh yeah, right. Statistics,
Math.
proportions.
Proportions. We're gay. We don't know any of these things.
We're just looking.
Always the takeaway is get vaccinated.
Just get it.
Get vaccinated, wear nice
vaccinated.
earrings, and find a gaping hole.
Yeah. I mean, if there is nothing else that we can share,
Cover it.
it's that. Yeah. Cover.
Yeah.
It's meant. Yeah. Exactly. All right. Well, I feel like we can leave it on that actually quite safely. That feels on brand for us. Everybody have a really good night and
Maybe see you soon.
take care of yourself and maybe we'll see you soon. Maybe no promises, but we'll try. Maybe.